Hi everyone, a blessed day to all of you. I'm praying that all of you are doing well and safe with your families and loved ones. Okay, so make sure that you keep yourself and your family safe at home, especially during this pandemic where the cases or the COVID cases in our country is increasing. Okay, so this week our topic is about nursing process. So this is your last topic before your midterm examination. It is actually kind of long topic, so make sure you have your something to eat beside you, okay, or be ready, prepare your coffee or your nuts beside you and water, okay, para while you are watching this presentation or this pre-recorded lecture, hindi kayo magugutom kasi it's kind of long at hindi kayo aantukin. Okay, so nursing process. Actually, this topic covers the chapter 10 to 14 of your book, no? This book, this one. Okay, the kosher and herbs. So, nandyan lahat ang topic natin for this week about the nursing process. Okay, so you are familiar with what is nursing process kasi ever since during your first semester, I have been mentioning this term to you. Diba? Sabi ko, the nursing process is a tool or a guiding tool for you that it will guide you all throughout your study and when you become a nursing. So, habang buhay mo nang gagamitin ang tool na to, itong nursing process na steps na to. Okay? So, make sure that you have to focus in this presentation. Kailangan you will understand kasi this is very, very important or vital in your nursing life, in your nursing study, and all throughout your nursing profession. Okay? Because you will be using this every time, every day when you are handling or providing care to your patients so that your care or will be effective to the client. Okay, so let us now proceed to our discussion. Okay, so in formulating or your nursing process involves critical thinking and clinical reasoning. Okay, so kailangan may critical thinking ka and critical reasoning para in providing care to your client so that your care would be effective at hindi siya maging harmful to your client. Okay, so what is critical thinking? So when you say critical thinking, you have to use your mind. Okay, so hindi lang basta using of the mind, it is the process of intentional higher level thinking. Okay, to define the following. So, hindi lang basta-basta you have to use the higher level of thinking. You have to define the client's problem. Ano ba yung client's problem that we are talking here? Of course, it involves the whole being of the client. The physical, the emotional, the psychological, the social, spiritual, and all dimensions of the client that might affect the client kaya nagkaroon siya ng client's problem. Examine evidence-based practice. Ano ba ang mga how to handle a certain kind of case, diba? Paano mag-provide ng care based on evidence. Okay? Ito yung mga ginawa ng mga nurses. Okay? Like for example, sa COVID-19 ngayon, if the patient has yung mga intubated client, may mga studies silang ginagawa na yung iba pinu-prone position, so it is still under study kung effective ba siya. So, kapag maraming study ang nagsasabing this kind of procedure is effective kasi nakakapag help siya to the recovery of the client, meron na tayong evidence-based. So, that is an example of your evidence-based practice. Just like the TSB, di ba? You have your TSB. or total sponge bath. Pinupunasan ang patient kapag mataas ang temperature. So, hindi lang basta-bastang ginagawa yun. There were studies made before. Pinag-aaralan yun. So, ibig sabihin, may mga evidences tayo that through TSB or total sponge bath, pwedeng bumaba ang temperature ng client. So, that is an example of your examined evidence-based practice. And make choices in the delivery of care. So, kasi maraming choices, maraming ang evidences. Just like na ang sinasabi ko sa inyo, just like in the recent situation, may nababasa tayo na if the client is medyo nahirapang huminga, may ibang bansa or ibang hospitals wherein yung mga COVID cases patient, pinuposition nila yung client into prone position. Okay, kaya lang minsan isipin mo, paano yun? Ang hirap, intubated na yung client, diba? Pinoprone position. So, may mga series of studies. So, may mga available choices din kung paano mo i-handle yung client. Okay? And then, in critical thinking, the nurses use knowledge from the subject and fields. So, yung mga nakuha mo, ano ba yung mga subjects? Through your studies, through your clinical practice, or through your experiences, diba? Through your related learning experiences doon sa area, sa mga fields kung saan ka na-assign. Okay, ano yung previous experience mo? Ano yung knowledge mo doon na nakuha? Okay, during your study, during your exposure to different areas. Okay, you can make use of that in choosing or making a decision or in providing client care. Okay? Nurses deal with the change in stressful environments, and nurses make important decisions. Ayan. Yan yung sa ating critical thinking. And clinical reasoning. Ano bang clinical reasoning? It is a cognitive process that uses thinking strategies. So, may gumagamit ka ng thinking strategies in order to, of course, to gather and analyze. What will you gather? Of course, you will gather data. You will gather information. And then, you will analyze those information. So, that is through your assessment. Diba? Natutunan nyo na yung physical assessment 1. In your physical assessment 1, kung napansin niyo there is a part 1 where in general interview ang gagawin natin dapat. Pero hindi na ako nag-in-depth doon kasi you will have lectures about that on your HA lecture. So, gather and analyze. You are gathering information. You are gathering history of the client, the chief complaint of the client. Ano ang history? You will gather subjective data and objective data. And later on, you will understand what is objective and subjective data. And then from that data you gathered, you have to analyze. You have to analyze for you to formulate what is the problem, what is really the problem, and then you evaluate, diba? You evaluate kung paano ba, ano ba ang pwede kong ibigay dito, yung actions ko ba, yung interventions ko ba is effective, so you evaluate that. And then you decide kung ano ba ang dapat mong gagawin para to help the client recover. Okay? So, in deciding, you have to use the information of the client, diba? On client's information, you have to decide on that, the care or actions, and the application of decision making. Okay. And then, of course, in your critical reasoning, you should have creativity. Ano ba yung creativity? Paulit-ulit natin is pinag-uusapan. Nursing is an art. So, you have to be creative in what way? In providing nursing care. Okay. So, creativity is a thinking that results in the development of new ideas and products. Okay? It is a major component of your critical thinking. So, it is the ability to develop and implement new and better solution for healthcare outcomes. So, ito yung nakita mong problema. you have to be creative. Paano ko ba gagawin? Ano ba yung dapat na solusyon? Ano ba yung way na dapat kong gawin para masolusyonan yung problem ng client? And there are techniques in critical thinking. Number 1 is your critical analysis, Socratic questioning, inductive reasoning, or specific, when you see inductive reasoning, from specific to general. Deductive reasoning is from general to specific. Ano yun? Pag sinabi natin critical analysis, okay. When you say critical analysis, you are applying, or it is an application of a set of questions. So, marami kang questions to a particular situation. So, marami kang magkikreate ka actually ng maraming tanong. Okay? Ito yung ginagawa ninyo during your interview. Diba? Naituro na rin sa inyo to sa health assessment. Ano ba yung mga i-interview nyo sa client? Kinukuha natin muna yung una, demographic data of the client. Okay, so marami kang questions, di ba? Marami kang, the purpose of that is to have tawag dito, informations, para magkaroon ka ng mga informations and ideas. Okay? And then, of course, yung mga questions that are not essential, or informations that are not essential in your judgment, okay, hindi siya kinakailangan pala sa clinical judgment mo to the client situation, so you have to disregard that. So that is your critical analysis. So you have to have a series of questions. Okay, dapat you should be aware that all of your questions should be related to the current situation of the client. So, una muna, of course, the demographic data. Dapat the name of your patient, saan si patient, ilang taon si patient, the weight, the height of the patient, what is the chief complaint of the client. Yan. From the chief complaint of the client, pag sinabi ni client na, masakit po yung ulo ko. Okay, so from that word, marami ka nang pwedeng itanong. Okay? Kritika, marami ka ng questions na ma-formulate. Kailan po nag-start ang sakit ng ulo mo? And etc. And etc. And then another way of, or another technique in your critical thinking is the Socratic questioning. So this type of questioning was actually formulated or developed by a Greek philosopher named Socrates. Okay, so it is a technique that one can use to look beneath the surface. Okay, recognize and examine assumptions. That is to search for, baka may mga inconsistency. Okay, to examine multiple points of view, and of course to differentiate what one knows and what one believes. So ibig sabihin, kasi iba yung alam, iba yung pinaniniwalaan ng client, di ba? So Socratic questioning is actually a form of analysis. This is actually used when the nurse report about a client's condition and the current status of the client, or in reviewing a client's history and the progress notes, and in planning care. So, Socratic questioning, in-depth, di ba sinabi natin, in-depth yung titingnan natin kung consistent ba ang sinasabi ng client, consistent ba yung data na kuha mo. Example, the subjective data is yung sinasabi ni client na, ay masakit ang ulo ko. And then, your subjective data is kinuha mo, nag-vital signs ka. Nung nag-vital signs ka, nakita mo nga na mataas ang BP ni client. Okay, so mataas ang kanyang BP. So, pwede ka nang mag-in-depth. You have to weigh. Kaya dito sa Socratic, mas maano siya kasi i-weigh mo kung yung sinasabi ni client at yung subjective data niya is consistent ba sila, or yung sinabi niya kanina consistent ba as you go through your interview. So that is Socratic questioning. And then inductive reasoning. Okay, example ng inductive reasoning, from specific to general. Examples, di ba? A nurse, di ba? During your physical assessment, integumentary, nakita mo during the physical assessment, when you look at the client's skin, it is very dry. It's not moist. Okay, it's very dry. And when you check the skin turgor of the client, it does not goes back to normal state agad-agad. So, and then when you check the conjunctiva, it's very dry. So, from those data, you can generalize. So, from specific to general. So, you can generalize that the patient might have dehydration. So, that is an example of inductive reasoning. So, nag-iisip ka, bakit napaka-dry? Bakit napaka-poor ng skin turgor niya? The conjunctiva is very dry. So, you generalize that the patient might have dehydration. Okay? And deductive reasoning naman, an example, so pag sinasabi natin deductive reasoning is from general to specific. Okay? So, example naman ito, ang isang bata ayaw niyang kumain. So, hindi siya kumakain masyado. And then, tinatanong mo what is the favorite of the child para lang makakain yung bata. Kasi, syempre, para mas mabilis ang recovery ni client. And then, nalaman mo that the client loves peanut butter or the client loves cream cheese, just like my son. He likes cream cheese. So, you will offer the child a sandwich with cream cheese. So, very specific, di ba? Kasi generalized to specific siya. Okay? And then, nursing process. Let us now proceed to the nursing process. Okay. So, there are characteristics of nursing process. It's a cyclic and dynamic in nature. So, when you say a cyclic and dynamic in nature, cyclic means, diba, circle. So, it moves into the circle. So, parang ganun din ang nursing process. Diba, may 5 steps. May 5 steps. The assessing, assessment, diagnosing, planning, intervention, evaluation. Hindi siya pa ganun actually. Hindi siya horizontal. Okay. It's a cyclic. Kasi, just in case dumating ka sa evaluation mo, hindi na-achieve ang iyong goal. Halimbawa, upon assessment, mataas ang blood pressure ni client. Okay, or mataas ang temperature ni client. So, yung planning mo is, of course, umiikot doon. Yung diagnosis, hyperthermia, may hyperthermia si client, so blah, 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 and you plan. And then, ang plan mo is to lower the temperature after 30 minutes. Tapos, ang care kasi natin doon, independent care natin is to provide TSB or total sponge bath. So, pupunasan mo si client. And then, after 30 minutes, ang goal mo is bumaba ang kanyang temperature from 39 degrees to at least normal temperature to at least 37. Ganyan. And then, upon evaluation, mataas pa rin ang temperature ni client. So, 38 pa din. So, pwede mo ulitin ulit. Okay, since hindi mo na-achieve ang iyong plan or iyong goal, so it's a cyclic kasi from evaluation, from your data in your evaluation, you can go back to assessment and then babalik ulit. So that's why it's cyclic and dynamic. So when you say dynamic, it is a process. So cyclic is a circular and it is a process. So it is a cyclic and dynamic nature. So, client-centeredness. Of course, it is the center of your care, or the central of your care is your clients. It should be client-centered and focused on the problem-solving and decision-making. So, it is interpersonal and collaborative style. When you say interpersonal, there should be a nurse-patient relationship. And collaborative style, you have to collaborate the other member of the healthcare team. You have to report to the physician or dietitian about the condition of the client. You have to work with the healthcare team member. So it is universal applicability. So from the world universe, so it's worldwide. So it is applicable to all countries internationally. Okay, itong nursing process. So, ibig sabihin, the nursing process is not only applicable in the Philippines or applicable in America. It is applicable in our world. So, that is your nursing process. And of course, it uses critical thinking and critical reasoning. Sorry, naputol yung reasoning. Okay. So, what is the purpose of nursing process? Of course, that is to identify a client's health status and actual or potential healthcare problems or needs. So, hindi lang current. Kung ano yung actual or ano yung risk ng client, ano yung possible na mangyari sa client from your assessment. So, ibig sabihin, we are not only treating here hindi lang yung illness ang ating or the current illness of the client. Of course, di ba, health promotion din tayo, the possible problem that might arise because of the situation of the client. And to establish plans to meet the identified needs, to deliver specific nursing intervention to meet those needs. So that is the purpose of your nursing process. So, there are steps, no? Add pi. Don't forget to add pi. Okay, so add pi. Okay, yan yung steps natin. Add pi. So, ma'am, what is add pi? Ma'am, sabi mo it's a cyclic. Eh, bakit parang horizontal yan? So, ganyan lang ang itsura niya. Okay, yan. Pero, babalik din yan sa assessment if ever na hindi mo nga na-meet yung goal mo, hindi ka nag-achieve, hindi nag-achieve, no? Hindi ka naging successful dun sa goal mo. So, pwede kang bumalik ulit. So, it's just the same with your life. Okay? So, if you are not successful in your plan, in your goal, you have to reassess. Saan ako nagkamali? Or kung bumagsak ka sa subject mo, you have to assess yourself, saan ako nagkulang? Saan ako nagkamali? You can actually, the nursing process, you can actually modify that and apply it in your studies, in your daily living. That process actually is applicable not only in providing nursing care to your client. Okay? So, let us discuss each of these topic. Actually, each of these it's a one chapter in your book. The assessment is one chapter, and each step is one chapter in your book. Okay, we will just summarize it here. So, assessing. So, from the word assessing, you will collect data. And what data you will collect? Okay, you have to organize the data. You have to prioritize the data. Okay, validate the data and document the data. Okay? Okay. So, assessment is the systematic and continuous collection, organization, and validation and documentation of the data. So, continuous ka. It is systematic. There is a process of collecting your data. Hindi lang basta-basta kung ano lang itatanong mo. Diba? That's why you have your health assessment. Okay. So, sa hospital naman, meron din tayong guide. Okay. In your assessment, meron tayong guide kung ano ba yung mga data that you will collect. And itinuturo din sa inyo yan in your health assessment. Okay, it is continuous kasi patuloy kang kumukuha ng data as long as the client is there. Okay, hindi yung porket, ay, kukuha ka lang ng data upon admission of the client and then tapos na kasi admitted naman na si client. So, habang nandyan si client, so every day pa rin, no? Not only every day, every shift, di ba? Before, pagpasok mo, pag alis mo, you have to assess the client if there is for you to know, that is for you to know that there is progress to the client's condition. And then again, you organize that data. When you organize, you have to prioritize ano ba ang mas kailangan client. And then you have to validate that data. And of course, may documentation ka. You have your charting. All phases of the nursing process depend on the accurate and complete collection of data. So, ibig sabihin, kapag incorrect or inaccurate ang iyong data, it might affect the total care or the care given to the client. Thus, it might affect the client's health. Diba? Okay. Collecting data. Collecting data is the process of gathering information about a client's health status. Okay? So, database, you have your database, which is wherein all information about the client. So, this involves your nursing health history. So, you have that in your health assessment. The physical assessment. Di ba ginawa natin yung physical assessment? Okay, yung general survey of the client. Di ba? Yung information, gathering the health history, the information, and then you assess the client, yung ginawa pa lang natin. Actually, in the physical assessment, it is head-to-toe assessment. Inuna pa lang natin yung part hanggang neck. Okay? The first care providers, history and physical assessment. The laboratory and the end diagnostic test result. You have to collect that as well, and that is part of your collecting or data collection. And there are types of assessment. So, initial, problem-focused, emergency, time-lapse reassessment. So, we'll discuss this each. Okay? When we say initial assessment, it is performed within specified time after admission to a healthcare agency. So, kakapasok lang or sa clinic, pumunta ang isang patient. Okay? That is your initial assessment. So, may complaint si patient. So, problem-focused assessment is an ongoing process integrated with nursing care. So, meron ng, actually, pag problem-focused, meron na siya actually, may na-identify na, may diagnosis na si doc. Okay? Kaya yung assessment mo is nakafocus ka na lang doon. For example, ang chief complaint ng client is abdominal pain. So, may diagnosis na si doctor na merong gallstone si client. So, your assessment, nakafocus na doon sa area na yun. Okay? But hindi ibig sabihin na yun na lang ang focus mo. Iba ka naman affected din yung other psychological, holistic na tayo. Pero meron pa lang pinaka-focus. Okay? And then, ano ba to? Bumabalik. Okay. Emergency assessment during any physiologic or psychologic crisis of the client. So, emergency. So, bigla ang assessment. So, mabilisan ang pag-gather ng data nito. Usually, ito yung ina-atake na client. Yan. Dinadala sa emergency. So, yan yun. Time-lapse reassessments. This is done several months after initial assessment. So, ito yung mga may follow-up. Okay. Ibig sabihin, may initial assessment na sila, may problem focus na possibly yung mga client na yun. So, time-lapse, the follow-up. If the client has hypertension or diabetes, so babalik siya sa clinic every 3 months para i-assess yung blood sugar, yung blood pressure ni client. Okay, there are types of data. So, paulit-ulit ko yung mention yung subjective data and your objective data. So, when we say subjective data, those are the symptoms. Okay, you are referring to the symptoms. Subjective symptoms. This is actually your covert data. So, apparent only to the person affected. So, paano maintindihan yung subjective data? From the word covert data, cover. Okay. So, ibig sabihin, cover. Hindi mo nakikita. Hindi mo nararamdaman. Only the patient can tell you. Like, masakit po yung ulo ko, masakit po yung tiyan ko. Nakikita mo ba yon? Hindi mo nakikita yon. So, that is subjective. Para maging objective yung data na yan about pain, usually tinatanong natin si patient, can you rate your pain using the pain scale, 0 as no pain, and 10 as very painful. Okay, so pag sinabi ni client number 6, o your pain scale is number 6, that is already objective data kasi meron ka ng numbers. Okay, objective, pero pag sinabi lang ni client, nahihilo ako, masama yung pakiramdam ko, that is subjective data. Objective is the signs. Okay, it is the signs or overt data. So, overt, ibig sabihin over or nakikita. Okay? Detectable by the observer. So, nadidetect ng observer. Who is the observer? You as a nurse. Okay? Can be measured or tested against and accepted standards. Just like what I mentioned a while ago about a pain scale. Pag sinabi ni client, masakit ang ulo ko, that is subjective. But when you ask the client using a pain scale na nagkaroon na ng number, ibig sabihin that is already your objective data. Another example of your objective data, hawag dito, pag sinabi niyang nahihilo ako, of course, hindi rin yan objective. That is subjective kasi you cannot measure it. So, example of your objective data is like your temperature. Di ba, kinukuha mo? Okay. Ano pa? The weight of the client. Ano pa? Nakukuha mo yan. The blood pressure of the client. Nahirapan akong huminga is subjective data. But you want to have an objective data. Okay, you count the client's respiratory rate. So that is your objective data. So I hope it is clear to you that the subjective data is all na sinasabi ni client that you cannot measure. The objective data is all na makukuha mo. Just like nakikita mo, nakita mo yung dry yung skin, yung mga ginawa natin sa physical assessment that you can measure or you can test. Okay, there are examples of subjective data and objective data. Just kindly double check kung is it the same. 189. Let me check, no? 189 table kasi baka magkaiba tayo. Yes, it is located in your table 189. May mga subjective and objective data rin. Examples. Okay? In your book, my edition is 10th edition. So, nandun siya sa page na yun. Okay, there are also types of your objective data. It could be constant and variable data. When we see constant data, information that does not change over time, just like the race and body or blood type. Yan, race or blood type. That is your constant data. Variable data can change quickly, frequently, or rarely, just like the BP, blood pressure, the age, and the pain. So, what are your sources of data? So, primary. So, primary can be taken from the client himself. This is actually the best source. Kasi siya talaga yun, di ba? Pag nag-interview tayo, minsan sumisingit yung mga relatives, no? Di ba? Minsan sumasagot yung relatives, eh. Syempre, it should be coming from the client kasi yan yung best source. Siya yung nakakaramdam. It should be from the client, no? Sometimes kasi, hindi nagsasalita ang patient. Ang sumasagot is the relatives. But of course, yun pa rin client ang kukunin ng data. Okay? Secondary. All information sources other than the client. So, these are the support people. Of course, the relatives. Okay? The immediate relatives, the caregiver. Yan. The client records. Okay, you check the client records. The healthcare professionals. The literature. So, that is your secondary source of data. So, components of health. Components of nursing health history. So, you have the biographic data. So, this includes the name of the client, the sex of the client, the age of the client, the weight of the client, and so on and so forth. The chief complaint or the reason for visit. Bakit po pala tayo napabisita sa clinic natin today? Sabihin ni client, masakit po yung tiyan ko. So, that is the chief complaint. History of present illness. Ano ba in the previous weeks? Ano ba ang kanyang nararamdaman? Nagpa-check up ba siya sa doktor? May hypertensive ba si client? Okay. Meron bang yung blood sugar ni client? Okay. Past history in the past. Okay. As for example, during pregnancy ba, nagkakaroon ba siya? Halimbawa, OB naman yung case natin. Sabi niya kasi, ngayon kasi, the present kasi meron siyang mataas ang blood pressure ni client or mataas ang blood sugar ni client. Meron siyang gestational diabetes. So, pang third na pregnancy niya. So, you have to gather, how about your second pregnancy? Nagkaroon ka rin ba ng history ng gestational diabetes or Diabetic ka ba during pregnancy? So that is past example of your past history. The family history of illness. May lahi po ba kayo ng cancer? May lahi po bang problema sa lungs? May lahi po ba ng diabetes, hypertension? So that is an example. So lifestyle. So alam na natin yung lifestyle niya. Active ba siya? Or sedentary yung kanyang lifestyle, more of nakaupo lang palagi, tapos kakain lang, hindi naglalakad. Social data, meron ba siyang, sino ang kasama niya, sino ang kausap niya, sino ang kanyang, may relatives ba to, may pamilya, yan. Social data. Psychological data, so gather ka rin ng history, nagkaroon ba ito ng psychological problems, patterns of healthcare, madalas bang nagpa-check up, okay, or magpapa-check up lang kung gusto or kailangan. So that is, so another example of that is, it is located in your, or you have another examples para mas maintindihan nyo, mas mabasa ninyo kasi mas mahaba siya, no? You can check it through your book on page 188, okay? Okay, so another example of your patterns of healthcare, saan ba siya nagpapacheck up? Kung nagpapacheck up siya, sa clinic ba, sa doctor ba, sa health center ba, or sa albularyo ba? So, yan. And so on and so forth. So, there are data collection, 3 data collection method. You can collect your data through observing. So, you are observing a client through interviewing and examining. Okay. Through observation. So, it is a conscious, deliberate skill that is developed through effort and with an organized approach. Interview is a planned communication or conversation with a purpose. Siguro naman naintindihan nyo yung observation. Di ba? Nag-observe ka lang. Tapos through your observation, nakuha mo yung data. Ay, bakit itong maglakad siya? Eh, parang ganun siya maglakad. Okay. Or ba't parang nakikita ko sa kanya kahit nandito ako, parang irritated. So that is observation. So you have data through your observation. Interview, of course, is a planned communication or conversation with a purpose, and there are 2 approaches. So directive interview, which is a highly structured and elicits a specific information. So you have your sets of questions. You have your paper. Non-directive interview is a rapport building interview. The nurse allows the client to control the purpose, subject matter, and pacing. So parang hayaan mo lang siya. Open-ended question. Okay. Unlike sa directive interview na parang may papel, may paper ka, may checklist ka na tinatanong mo si client, sasagot siya. Okay. Structured. Okay, pwedeng yes or no yan. For the directive interview, patuloy lang si client na magsasalita. Yan. So, types of interview question. There are closed question and open-ended question. So, closed question is usually used in directive interview. So, closed, restrictive, and generally requires yes or no or short factual answer. Ito yung sinasabi ko sa inyo na yung closed question is used in directive interview. For the non-directive interview, ayan, open-ended question yung gagamitan mo interview. That is to invite the client to explore their feelings. Paano po ba yung sample ng open-ended interview? So, kumusta naman po ang inyong pakiramdam ngayon? Yan, mahaba yan. Mahaba na sasabihin ni client. Yan, ay, pakiramdam ko ganito, ganyan, ganyan, ganyan. So, napakahaba. Pag open-ended question, from the answers of the client, you can create another questions na naman, di ba? Tapos, pamamagitan ng kanyang answers. So, may question ka ulit na mo-formulate hanggang sa makakuha ka, makagather ka ng maraming data. Hindi lang data for chismis, of course, data that is necessary in planning care for your client. Okay? So, neutral question is a question that the client can answer without direction or pressure from the nurse. Leading question, it directs the client's answer. Okay? Example of those questions can be found on your page 191. Okay, so 191. So, kung actually, kung ano tayo, kung tawag tayo dito, ibig sabihin, kung face-to-face tayo sana, may mga, papabasa ko sa inyo yung mga magre-recitation tayo. Open your book on page 191. And then you can see an example of closed question and tawag dito, and your open-ended questions. So, example, mga examples, so ang daming examples ng mga open-ended questions. Okay? Planning the interview and setting. So, in planning the interview and setting, it involves the following: the time. When the client is physically comfortable and of course free of pain. Kasi kapag in pain yan si client, obviously that is very irritated and you cannot get accurate information. Place, it should be well lighted, well-ventilated room that encourages communication. Baka sobrang init naman, irritable si patient, or sobrang lamig sa client. Seating arrangement should be in less formal atmosphere. Distance, neither too close or too far, at least 2 to 3 feet. Proxemics is the study of use of space. Language, and of course, you have to use language that both the parties can understand. Okay. Alam mo, Tagalog yung pasyente mo, mag-i-English ka, baka hindi ka maintindihan. There are 3 stages of interview: the opening or your introduction. In your opening, you have to make sure that you establish rapport and orient the interviewee. Okay, orient the client, to explain the client what is the purpose of that interview and why you are there. You have to explain that you are going to gather information that are very necessary for the client's care. Okay, and then the body or the development. Nurse must use information technique for effective interview. Okay, you can also find that in the book, chapter 11. Closing or termination. When information needed has been obtained, okay, important in maintaining the rapport and trust and for facilitating future interaction. So, closing na, tatapos na ang interview. So, ibig sabihin, nakuha mo na lahat ng kailangan mong data. Na-saturate mo na, paulit-ulit na kayo. Ibig sabihin, nakuha mo na lahat, wala ka nang makuha information. So, that is in your termination. So, ibig sabihin, it is very important that you establish rapport. Ibig sabihin, you can gain the trust of the client, wherein the client will trust you and ibibigay niya sa iyo ang mga data or information that you are looking for because it is necessary for the patient's care. Okay, asan na tayo? Okay, the third method, no? Examining. So, that is using your physical examination or physical assessment. Wherein it is a systematic data collection method that uses your observation. So, napansin nyo yun? You're using the 5 senses to detect the health problems of the client. Just recall your physical assessment. 1. Diba? You are using your 5 senses. Your sense of sight. Diba? Tinitinan mo yung body posture ni client, yung gait ni client, sense of smell, yung amoy ni client, sense of touch, di ba? Yung ginahinawakan mo siya, temperature ni client, okay. The sense of your hearing, okay. Taste, tatikman mo ba si client? Okay. To conduct the examination, the nurse uses inspection, auscultation, palpation, and percussion. Inspection, pag sinabi natin inspection, you have to use your eyes. Okay. You have to use your 5 senses. Pag you have to use your eyes, usually yan, yung inspection. Auscultation, you have to use your bell of stethoscope. Palpation, you have to use the sense of touch. Percussion, sense of touch pa rin yan. Ganyan ang percussion. Okay, tuturo ko rin yan in your physical assessment 2. Cephalocaudal, meaning head-to-toe approach. You have to examine head-to-toe approach para kapag talagang medyo complicated ang problem. Body systems approach, depende by system. By system yung kunin mo kung meron ng meron na talagang complaint ang client. Screening examination or review of the systems. It is actually a brief review of essential functioning of various body parts or the system. So that is collecting data through examining or examination. Part 2, organizing data. So, let's move on to meron ka ng data collection. So, let's organize your data. Nurses uses a written format that organizes the assessment data systematically, often referred to as a nursing health history, nursing assessment, or nursing database form. So, nursing models provide formats for collecting and organizing client data. So, sila yun. How to organize your data. Diba? Si Gordon's typology of 11 functional patterns. So, ito yung madalas na ginagamit for the case study. ORM self-care model. So, isa-isahin natin yan. The Roy's adaptation model. Yan. Ito yung the Gordon's typology of 11 functional patterns. So, you can also see an example on your page 196 of your book. So, here, makikita mo yan sa book, sa page 196. Ayan, the Gordon's, mahaba siya. Okay, adaptive model. Okay, so tingnan nyo na lang yung libro ninyo. So, yung una is the health perception, or health management pattern. So, meron yang mga under the usual eating pattern of the client, if you're a client, understand the medical diagnosis of the client. So, hindi na natin isa-isahin yan. Okay? Ay, sorry. Nutritional or metabolic pattern of the client. So, kinukuha natin yung mga temperature ni client dyan sa nutritional metabolic pattern. Okay, ano pa? Yung height ni client, yan, temperature or anong kinain na client, yung appetite ni client, yan. Elimination pattern. Yung elimination pattern, yung urinary, ilang beses siya umihi, bowel movement, araw-araw ba nakadumi, yan. Activity exercise pattern. Okay? May mga examples din dito, no? Ang example sa book, sa activity pattern is, or exercise pattern, no musculoskeletal impairment. These are the example findings. So, ito yung kailangan yung gawin. So, after your midterm, papagawain ko na kayo ng ganitich. Okay? So, what else? The activity, sleep, rest. Okay? Sleep, rest pattern. Okay. Yung tulog ba niya? Ilang oras? Mahaba ba ang tulog ni patient? Okay? Cognitive, perceptual pattern. Okay? Cognitive, perceptual pattern. Yan. Ang example niyan is no sensory defects, yung pupils, so yun yung cognitive perceptual pattern. Okay? Self-perception or self-concept pattern. So, well-groomed or the client says too tired. So, that is example of self-perception. Role relationship pattern. Yan. Saan ba nakatira? It lives with the husband. Yan. Sexuality or reproductive pattern. Ilan ang anak? Okay. Coping or stress pattern. Anxious ba si client? Ano sinabi ni sa client? I can't breathe. Yan. Value belief pattern. Is it a Catholic? Catholic ba si client or not? So, may mga examples pa tayo dyan. The ORM self-care model. So, pwede mo rin i-arrange yung data using the ORM self-care model. There are 6 self-care requisites common to men, women, and children as follows. Number 1, the maintenance of sufficient intake of air, the water, and the food. So, ang data mo dyan is about the air, water, and food. The provision of care associated with elimination pattern or processes and excrements. The maintenance of balance between activity and rest pa rin. Okay? Tulog niya, nag-exercise ba, naglalakad ba? The maintenance of balance between solitude and social interaction. the prevention of hazards to human life, human functioning, and human well-being, and the promotion of human functioning and development within social groups in accordance with human potential, known human limitations, and the human desire to be normal. So, let us move on to the Roy's adaptation model. So, ito yung adaptive modes naman ni Roy. Okay? So, i-check mo yan. Yung physiologic needs ni client, yung activity and rest. So, halos actually magkakapareho lang din sila. So, magkakaiba lang sa ibang part. May activity and rest din si Gordon's, and yung previous model natin, si Orem. And the nutrition, elimination, fluid and electrolytes, oxygenation, protection, regulation like temperature, the senses of the client, sense of smell, sense of taste, the endocrine system of the client, the self-concept, the role function, and interdependence. You can also find some examples of that. Wellness model. So, ano naman ang pagkaka-arrange ng data mo? Nurses use wellness models to assist the clients to identify health risks and to explore lifestyle habits and health behaviors, beliefs, values, and attitudes that influence the level of wellness. Ito yung mga health history of the client. So, kung naman yung health history, physical fitness evaluation, nutritional assessment, yung weight ni client, life stress analysis, lifestyle and health habits, health beliefs, sexual health, spiritual health, relationships, and health risk appraisal. So, those are the data that you will collect if you will be using the wellness model, and you will arrange it according to this arrangement. Using the non-nursing model. So, these frameworks are narrower than the models required in nursing. The nurse usually needs to combine this with other approaches to obtain complete history. So, ginagamit din to. So, kino-combine natin with other approaches. Pwede mong i-combine ito sa Gordon's model. Okay? Body systems model kasi to. Wherein mag-start tayo. Ito na yung sa physical assessment natin. Yung integumentary system, respiratory system, cardiovascular system. Lahat yan, meron din yan sa physical assessment ninyo. Kasi ang ginawa natin is more of integumentary pa lang ang nakasama doon. Respiratory system, sa vital signs, nakuha nyo na yan. Cardiovascular system, nervous system, musculoskeletal system, gastrointestinal system, genitourinary system, reproductive system, and the immune system. So, titingnan, kukuha ka ng mga data dyan. Isa-isahin mo, i-assess mo yung mga data na yan. Okay, yung mga parts na yan. Or you can also use, or you can arrange your data according to Maslow's hierarchy of needs. So, alam nyo naman, kay Maslow, there are 5, diba? Yung una dyan is, of course, ibig sabihin, kung ano yung pinakamalaki dyan, yung nasa lower, yung pinakamalaking part, ibig sabihin, malapad, mahaba, that is your basic needs. Yan yung priority, diba? The physiological needs. Or within physiological needs, of course, includes your breathing, water, and so on and so forth. Safety, love, belongingness, esteem, or self-esteem, and self-actualization. So, you can arrange it according to Maslow's hierarchy of needs. And the developmental theories, pwede rin yan din ang way of your arrangement. So, the having hurts, age period, and developmental task. Ibig sabihin, by age, ano yung developmental task ba? By age, diba? Ganun din si Freud's 5 stages of development. Ano yung mga needs per stage? You can arrange it according to that. Erickson's 8 stages of development, Piaget phases of cognitive development, Kohlberg's stage of moral development. So, pwedeng ito rin yung gagamitin natin, developmental theories. So, actually, iba-iba. Ito, more of ginagamit ito, mas maganda siyang ginagamit kapag child, diba? Yung developmental stage of the child. Validating it, since you have your data collection, and you know how to organize your data according to the different methods, diba, na sinabi natin, this time, we have to validate the data. So, validating the data is the act of double-checking. Okay, you double-check or verifying data to confirm that it is accurate and it is factual. So, to be able to make sure that your data are factual or it is validate, that your data is validate, you ensure that the assessment information is complete. Ensure that the objective and related subject data agree. So, agree sila. They are not opposing yung objective data na nakuha mo and yung sinasabi ni client. Obtain additional information that may be overlooked. Okay? Differentiate between the cues and inferences. The cues, when we say cues, these are the subjective or objective data that can be directly observed by the nurse. Inferences, these are the nurse's interpretation or conclusion made based on the cues. Ito yung interpretation mo or conclusion based on the cues, based on the subjective or objective data. You should avoid jumping to conclusions and focusing on the wrong direction to identify the problems. So, let us now proceed to documenting. So, you have to document na all the data you gathered since it is na-validate mo na. So, to complete the assessment phase, the nurse records the client data. Accurate documentation is essential and should include all data collected about the client's health status. Data are recorded in a factual manner and not interpreted by the nurse. So, factual manner dapat. So, let us now proceed to the next step or the second step of your nursing process. You have now your assessment. You know how to assess, you know how to organize, to validate, to document all your data. So, let us now proceed to diagnosing. So, when in diagnosing, you will analyze the data you gathered. You identify health problems, not just the current problems, but the risk and the strengths. Formulate diagnostic statements. Of course, your diagnosis is nursing diagnosis, not the medical diagnosis. Okay, diagnosis. Diagnosis is a nurse's, in diagnosing a client, the nurses use critical thinking skills to interpret assessment data and identify the client's strengths and problems. So, diagnosis actually in 1973, identification and development of nursing diagnosis began. Okay, 1973 pa lang. Wherein si Kristen Gebby and Mary Ann Levin perceived a need to identify nurses' roles in the ambulatory care setting sila. So, the St. Louis University School of Nursing and Allied Health Professional sponsored the first national conference to identify nursing diagnosis. So, the purpose of NANDA, North American Nursing Diagnosis Association, is to define, to refine, and promote a taxonomy of nursing diagnostic terminology of general use to professional nurses. When we say taxonomy, it is a classification system or a set of categories arranged that is based on a single principle or a set of principles. So the members of NANDA are staff nurses, clinical specialists, faculty, directors of nursing, deans, theorists, and researchers. They currently approve over 170 nursing diagnoses, labels for clinical use and testing. In 2001, Taxonomy 1 was revised to Taxonomy 2. So these are the definition of terms. Diagnosing. When you say diagnosing, you are referring to reasoning process. Diagnosis is a statement or conclusion regarding the nature of a phenomenon. Diagnostic labels. It is a standardized NANDA names for the diagnosis. And nursing diagnosis is the client's problem statement consisting of diagnostic label plus the etiology. So what are the type of nursing diagnosis? So there are Actual diagnosis, wherein it is the client problem that is present at the time of the nursing assessment. Risk nursing diagnosis is a clinical judgment that a problem does not exist. So, ibig sabihin, hindi pa. So, actually, ito yung current problem of the client. O hyperthermia. Okay, merong hyperthermia si client. Or difficulty of breathing si client. Diba? Yan yung difficulty of breathing. Current yan. O, risk. Nakita mo si client may wound. So, you can say risk for infection kasi may open wound si client. Okay, risk for infection. So, that is risk possible. Possible risk si client na magkaroon ng infection kasi meron siyang surgery. Meron siyang incision. Yan. Wellness diagnosis. It describes the human response to level of wellness in an IFC that has a readiness for enhancement. So, IFC means interferential current therapy. Okay? Possible nursing diagnosis is one in which the evidence about the health problem is incomplete or unclear. This requires more data either to support or refute it. Syndrome diagnosis is a diagnosis that is associated with a cluster or other diagnosis. For more examples, maybe you can also check your book. So, the components of a NANDA nursing diagnosis, meron tayong problem or diagnostic level and definition. So, this describes the client's health problem or response for which the nursing therapy is given. So, the purpose is to direct the formation of clients' goals and desired outcomes. So, it has qualifiers, no? Or words that have been added to some NANDA labels, like deficient, inadequate. When you say deficient, inadequate amount, quality, degree, insufficient, or incomplete. So, makikita mo yan doon sa NANDA nyo. You have to try opening your NANDA book. Kasi yung NANDA book, hindi ko ma-open yan sa electronic. Okay? So, may maraming example ng deficient. Impaired, made worse, or weakened, damaged, reduced, deteriorated. So, yun yung ibig sabihin natin. Impaired body image, example. Decrease in size, amount, or degree. Ineffective coping mechanism. Example yan, not producing the desired effect. Yan. Compromise, to make vulnerable to threat. Yan. And another component is your etiology or related and risk factors. The etiology component of a nursing diagnosis identifies one or more probable causes of the health problem and the defining characteristics. These are the cluster of signs and symptoms that indicate the presence of a particular diagnostic level. So, actual nursing diagnosis, actually, it involves signs and symptoms. So, merong signs and symptoms. For risk, no signs but may symptoms. Function that cause the client to be more vulnerable to the problem. So, yan, may mga subjective. Nursing diagnosis versus medical diagnosis. What is the difference between the two? So, let us differentiate. So, when we say nursing diagnosis, it is a statement of nursing judgment, and it refers to a condition that the nurses, by virtue of their education, experience, and expertise, are licensed to treat. Okay? It describes the human response, a client's physical, sociocultural, psychological, and spiritual response to an illness or a health problem. When we talk about medical diagnosis, it is usually made by the physician, and it refers to a condition that only a physician can treat. So, it refers to a disease process, a specific pathophysiology, responses that are fairly uniform from one client to another. So, fairly uniform sila. Halimbawa, may abdominal pain. Sabihin natin, diabetic sa client. So, diabetic din yung kapilang client. So, yun lang ay titrip nila, yung diabetes. But when we say nursing diagnosis, ang nursing diagnosis natin, di ba, we treat our client as as unique. So, may unique needs ang ating mga client. So, we have to design our patient care unique for a client, or it should be individualized for the client. So, it's unlike medical diagnosis na more of prescription of medication lang sila. Medication, for example, to treat, to lower the blood sugar. So, therefore, they will give medication to lower the blood sugar or blood pressure of the client. So, that is medical diagnosis. So, more of they will treat the client's sign and symptoms through medication. Okay, tayo, we will treat the client signs and symptoms through our nursing care or certain procedures that you learn from the school. So, nursing diagnosis versus collaborative problems. Okay? Collaborative problem is a type of potential problem that nurses manage using both independent and dependent interventions. So, collaborative problems are present when a particular disease or treatment is present. That is, each disease or treatment has specific complications that are always associated with it. So, you need a collaboration with the client, with the patient. And not all the time kasi yung nursing care natin, yung nursing care plan natin is more of nursing lang talaga. Sometimes, kailangan natin ng collaborative intervention. So, it should be collaborative. Hindi lang independent palagi. Sometimes, may dependent interventions tayo. Wherein, we need the help of the doctor. Just like for example, ginawa mo na, nagpunas ka na sa patient, pinunasan mo na si patient, very high ang kanyang temperature. Oo nga, in our nursing study, meron talaga na pwedeng bumaba ang temperature ni client through total sponge bath. But sometimes, hindi naman talaga nag-i-effect. Bababa lang siya sandali, tataas na naman ulit. So, meaning to say, kailangan mo rin talaga ng medication, kailangan mo rin talaga ng dependent intervention, wherein kailangan mo magbigay ng paracetamol. It's, of course, hindi ikaw ang mag-order ng paracetamol. You have to report it to the doctor. And as part of your nursing care plan, you have the independent intervention which is your total sponge bath, and your dependent intervention is the giving of the oral medication such as your paracetamol. So that is your independent intervention. So that is already collaborative kasi you have to collaborate with the other healthcare team. Okay? The diagnostic process involves the following. Of course, the critical thinking. Diba pa ulit-ulit natin pinag-usapan ng critical thinking kanina, which is the cognitive process during which a person reviews the data and considers explanations before forming an opinion. Sino tong person na you are referring here to the nurse, di ba? You are the nurse, or not just the nurse, it could be the doctor, okay? Kasi diagnostic process lang, yan pwede mag-diagnosis din yung doctor. But here, in this discussion, the focus is the nurse, okay? So, as a nurse, you are reviewing the data and explanation, and consider explanation before you form an opinion. Or why? Bakit nagkaroon ng ganun? Bakit tumaas ang fever ni client? Or bakit may pain si client? And it involves also analysis, which is the separation into two components, deductive reasoning. Deductive meaning deducing from general to specific para makita mo yung problem. So, synthesis is the act of putting the parts into a whole. So, inductive reasoning naman. So, inductive, para hindi kayo malito dito sa deductive, deduce, so pa-iiksiin mo into a specific, para maging specific, makuha mo yung problem. Synthesis naman into general. Okay, ito yung natin, i-generalize natin. And synthesis involves 3 steps. Analyzing the data, identifying the health problems, the risk and strength, and formulating diagnostic statements. Okay, let's go. Are you ready? Okay, so ganyan, no? Sarap tumakbo. Ganyan. Okay, let's proceed to diagnosing. Okay. The purpose of diagnosing is to identify the client's healthcare needs and to prepare the diagnostic statements. So, nursing diagnosis is a statement of client's potential or actual alteration of health status. So, meaning to say, yung nursing diagnosis mo, pwedeng, hindi lang tayo referring doon sa current, the possible also, na pwedeng mangyari. So, very ahead tayo kung napapansin niyo. Parang that is to prevent more problem to the client. And these are the components of your nursing process. The diagnostic statement. It involves the diagnostic label, yung etiology, the defining characteristic. And the defining characteristics are the signs and symptoms. It could be subjective and objective data or clinical manifestations. So the phrase used here is as evidenced by is joined to the first two components. Okay. So gagamit tayo ng diagnostic label as evidenced by or as manifested by. So as manifested by. Ayan. Sa ibang book or sa bagong book ngayon as manifested by na A and B. So in the previous book, in the previous edition as evidenced by. So, it involves analyzing the data, okay? In analyzing the data, merong 3 steps. Compare data against the standard and cluster the cues and identify the gaps and inconsistencies. So, ika-cluster natin yung cues. Yung cues, yung mga subjective data natin. Compare and then tingnan natin yung gap. May inconsistency ba yung data na yun? Okay, compare data with standards. How? Nurses draw on knowledge and experience to compare client data to norms and standards and identify significant and relevant cues. So, example of your comparing the cues to standard can be found on page 205, table 12 to 4. So, read it. The clustering cues. It is a process of determining the relatedness of facts and determining whether any patterns are present. So your example also can be found on your page 206, table 12 to 5. So identifying gaps and inconsistencies. These are conflicting data. Examples. Invalidating data assessment can be found on page 198. So, in identifying the health problems, the risks, and the strengths, meron tayong the following, determining problems and risks. The nurse must determine if the client's problem is nursing diagnosis. Nursing diagnosis ba yung client problem? Medical diagnosis ba yun? Or collaborative problem ba yun? Again, it can be found in your book on page 208. So, anong sabi dito? So, meron dito kayong makikita na example kung collaborative or actually lang siya pattern how to check, okay? And determining the strengths, then the nurse and the client also establish the client's strengths, abilities, resources, and abilities to cope. It can be found in the nursing assessment record as well. So, in formulating the nursing diagnostic statements, meron tayong the following. Could be 3-part statements, 2-part statements, or 1-part statement. So, how is it? May mga example tayo later on. So, in formulating your diagnostic statement, you have to use the PE or PES format. So, PE stands for problem and etiology. Ano ba ang problem? Ano ba ang etiology? Okay. PES, it includes the problem, etiology, and your signs and symptoms. Yan. For 2-part statement, usually it is a statement of the client's response. It is NANDA label. Paano po ba yun? Wait lang ha, may example tayo later on. Etiology refers to the factors contributing to or the probable cause of the responses. So, it uses related to indicate relationships. Okay? Pag 2-part, meron kang, yung nakuha mo sa NANDA, related to, impaired body image, related to, diba? Impaired body image, related to, ano yung etiology? Problem, example, constipation and anxiety. Yan. Constipation. So, ito yung problem na makuha mo actually. Ito, makikita mo to constipation. Makikita mo rin yan sa NANDA. Related to, ito yung ating, di ba? Ito yung idudugtong natin sa PA. To prolong laxative use. Ito yung etiology natin. Okay? So, ibig sabihin, constipation here is the problem. Plus your related to and the prolonged laxative use is your etiology. You can also check this in your NANDA book. Okay, another, anxiety. So, anxiety is your problem here. So, nakita mo, upon assessment to the client, may anxiety si client. Related to possible cancer diagnosis. Yan. And formulating a diagnostic statements using three-part statement, ito naman siya. Okay? As manifested by, kasama na nito. So, problem, again, statement of the client's response, etiology, factors, so, nasabi na natin yan, related to, and hindi lang related to ang gagamitin natin kasi three-part na to. And meron na tayo as manifested by or as evidenced by. Yan. The sign and symptoms, defining characteristic manifested by the client. So, ito yung sign and symptoms. So, example, ang problem is low self-esteem. Yan. Low self-esteem, ito yung problem. Related to feelings. Ito may related to tayo. Feelings of rejection by the husband. Feelings of rejection by the husband is the etiology. As manifested by, this is your sign and symptoms. Or the sign, di ba PES? Problem, etiology, and symptoms. So, as manifested by hypersensitivity to criticism, states, ayan, I don't know if I can manage myself and rejects positive feedback. So, yun yung example mo. Ito yung example ng ating three-part statement ng diagnosis. So, make sure na intindihan nyo kung paano mag-formulate ng nursing diagnosis. May two-part ka na, may three-part ka. So, kung napansin nyo doon sa two-part lang, wala siyang as manifested by or as evidenced by. Okay, walang signs and symptoms. Hanggang dyan lang. Sa three-part, merong signs and symptoms. Okay. Yan yung example. So, writing na nursing diagnostic statement, PES format. O, another example, acute pain. This is a problem. Related to tissue ischemia. That is your etiology. Pag PES, manong as evidenced by or as manifested by, statement of I feel severe pain on my chest. So, that is your sign and symptoms. Okay, I hope na gets na ninyo. Because later, you have your group work. Okay, pag one part lang, use on wellness diagnosis and syndrome diagnosis. Ayoko nito, gusto ko three-part. Three-part ha, pag pinagawa ko kayo ng nursing diagnosis. Laging three-part. Okay? Three-part or two-part. Kung wala talaga, kung hindi talaga kaya, two-part. No related to etiology and defining characteristics. Kasi one part lang siya. NANDA has specified that any new wellness diagnosis will be developed as one-part statements, beginning with the words, readiness for enhance. Yeah. So, these diagnostic statements, kapag three-part statements, actually these are actual nursing diagnosis. Okay, so alam nyo na, kung actual current problem yan, ibig sabihin current problem yan, you have to use three-part statement. Okay, actual. Pero pag two-part, possible lang. So, kaya wala pang as manifested by or as evidenced by. So, two-part siya kapag risk or possible nursing diagnosis pa lang. Or risk nursing diagnosis. One-part statement kung wellness nursing diagnosis or syndrome nursing diagnosis. So, sana clear sa inyo lahat ha. Three-part kapag actual. Two-part kapag possible pa lang na mangyari doon sa client or risk, di ba? Risk for infection. Okay, possible for. Two-part lang. Two-part. Okay. So, do you have still energy? Parang naubusan na ako ng energy. So, 1 hour mahigit na tayo. Okay, let's continue. Variations of basic formats. Formats, hindi formats. Okay? Writing a known etiology when the defining characteristics are present, but the nurse does not know the cause or contributing factors. A known etiology. So, non-compliance. Related to medication regimen, related to unknown etiology. Okay, using the phrase complex factors when there are too many etiologic factors to state in a brief phrase. Okay, chronic low self-esteem related to complex factor. Baka yan lang gagawin nyo, may complex factor or unknown etiology, ha? You have to analyze pa rin the data. Okay? Using the word possible to describe either the problem or the etiology. Example, possible low self-esteem related to loss of job. Using secondary to divide the etiology into 2 parts, making the statement more descriptive and useful. Example, risk for impaired skin integrity related to decreased circulation secondary to diabetes. Yan, pwede rin yan. Adding a second part to the general response or NANDA label to make it more precise. Example, impaired skin integrity, left lateral ankle, related to decreased peripheral circulation. So, these are example of your nursing diagnosis. So, in avoiding errors in diagnostic reasoning, you must verify the data. Build a good knowledge base and acquire clinical experience, of course. Having a work knowledge of what is normal, consult resources, and of course, base diagnosis on patterns, on behavior over time rather than on an isolated incident. Improve critical thinking skills. So that is for you to avoid errors in diagnostic reasoning. Kasi baka mamali na rin ang iyong care to the client. Okay, finally, we're done with the 2 steps. 3 more steps to go. So, planning. Okay, ayan na sa SpongeBob. Hirap na hirap sa pagpa-planning. Okay, you have to prioritize problems or your diagnosis kasi nakita mo, ang daming problems, ang daming diagnosis sa pan-assessment. You have to prioritize ano ba yung mas kailangan ni patient. Ano ba yung emergency or emergent, di ba? Formulate goals or desires outcome. Select nursing intervention and write nursing interventions. So, those are included in your planning. So, planning is the formulation of guidelines that establish the nursing action in the resolution of nursing diagnosis and the development of the client's plan of care. So, it involves 4 critical elements. The setting priorities, it is very important na ma-set mo yung priorities. The establishing the client's goals or desired outcome. Ano ba yung gusto mong mangyari to the client? Ano yung priority mo? Halimbawa, ano mas priority mo? Pababain ang temperature? O pababain ang kanyang blood pressure? Okay. Yan. Establishing client goals, selecting nursing intervention and activities, and writing individualized nursing intervention on care plan. So, isa-isahin natin yan later. So, the purpose of planning is to identify client's goal and appropriate nursing interventions. To direct the client care activities, to promote continuity of care, to focus charting requirements, and to allow delegation of specific activities. So, that is the purpose of your planning. So, kailangan ko pa bang i-explain isa-isa? Okay, para mas maintindihan ninyo. Yung purpose, to identify client's goal and appropriate nursing intervention. Ano ba yung goal mo for the client? Ay, goal mo, pababain ng, sige, kasi temperature na tayo at mas madali yun. So, paulit-ulit na lang yung example natin. Goal mo is pababain mo yung temperature niya. Ano pa yung nursing intervention doon? Ang example of nursing intervention is yung TSB mo, total sponge bath na gagawin mo to the client. That is example of your independent nursing intervention. Hindi bababa ang temperature, so meron kang dependent intervention. Ang dependent intervention mo doon is giving paracetamol. Kasi as ordered by the doctor. And then to direct client care activities, okay? Para malaman mo na kaya ba ni patient to upon your assessments. Of course, probably, iba naman yung problem, hindi naman temperature. Okay, baka naman mobility, hindi kaya ni patient, di ba? Hindi makagalaw masyado si client. Okay? To promote continuity of care, yan. From your plan, from your assessment, from your assessment, you can create a plan para mapagpatuloy mo yung pagaling ni patient. Nakita mo, may improvement. So, ano pa yung pwede mong gawin para mapapatuloy yung care mo to the client? To focus charting requirements, okay? Kailangan, ano ba ang mga kailangan ilagay doon sa iyong documentation? Ano ba ang pwede mong i-delegate, pwedeng gawin sa ibang member of the team? Pwede mong i-delegate to the caregiver, to the nursing aides. Pwede mong ibigay na work para hindi na naman super overload. Ano yung pwedeng i-delegate na task? So, nursing intervention. So, ano ba ang nursing intervention? Napaka-sexy naman ng nurse na to, no? So, nursing intervention is any treatment based upon clinical judgment that a nurse perform. So, it is also called nursing orders. So, kung meron tayong medical orders, meron din tayong nursing orders. So, there are 3 types. Independent, dependent, and interdependent or your collaborative intervention. Okay, your nursing intervention must meet the identified goals. Ano ba yung na-identify mong goal? Mataas ang temperature, paulit-ulit tayo sa temperature kasi mas madaling example. So, your goal is pababain ang temperature ni client. Or pain, pababain ang pain scale ni client. So, yan. Each nursing intervention must be supportive by a scientific rationale. So, that's why meron kayong part doon sa NCP ng rationale. Example, the problem is fever. Okay, kita mo dito, fever din talaga yung example kasi ito yung pinakamadali na problem. You have to do TSB or total sponge bath every 15 to 30 minutes. So, that is your scientific rationale here is to lower down the body temperature. So these these are actually dependent. Independent. Okay, independent intervention. Advice to increase oral fluid intake. Yan yung mga intervention mo. To 8 to 10 glasses per day as tolerated. Your rationale here is to replace the fluid and electrolytes lost. Okay, let us now proceed to your nursing care plan. Okay. Example ng nursing care plan. Ano nga ba ang nursing care plan? Nursing care plan is a blueprint of a nursing process. Okay. So, it provides direction for individualized care. So, for continuity of care, okay, you have to remember that something that is not written is considered not done. So, it is important that you have your nursing care plan wherein, ito yung blueprint, sinulat mo kung ano yung plan mo, plan of care for the client. There are 3 types of planning, the initial planning, the ongoing planning, and the discharge planning. Sorry we jump into planning kasi para maintindihan niyo yung nursing care plan kasi nasa part pa tayo ng planning, 'di ba? Nasa 3rd phase pa lang tayo, 3rd step. So, pag-usapan na natin dito ang nursing care plan kasi this is very important. Sa nursing care plan, actually nandun lahat yung 5 steps na yun or 5 process. Initial planning, ongoing planning, and discharge planning. So, in initial planning, it involves development of the beginning care of the nurse. So, ongoing planning, so it entails continuous updating of client's plan of care. And discharge planning, it involves critical anticipation and planning for the client's needs after discharge. So, ibig sabihin, initial planning, upon. So, unang pagkikita ninyo kay client. Ongoing, currently admitted si client. Discharge, pauwi na si client. Okay, initial, upon admission, ongoing, while the patient is in the hospital or during admission, diba? Discharge, pauwi na si client. Acronym, methods. Meron tayong methods that you have to remember. Method stands for medicine, exercise, treatment, health teaching, outpatient, department, and diet. Ano yung methods na yan? Baka naguluhan ko yung saan ang methods. Actually, sa discharge planning, meron kang tatandaan dapat na methods. Ito yung in your plan, ibig sabihin, sa planning mo for the discharge plan, dapat meron tong method na to. Ano ba yung method na yan? Doon sa plan mo, dapat kasama yung mga medicines. Ano ba yung medicines? Of course, ito yung mga doctor's order, take home medication of the client, ano exercise na gagawin ni client sa bahay, ano yung treatment ni client na gagawin sa bahay, ano yung mga health teaching mo kay client. Okay, halimbawa, may post-surgery si client, how to do wound care at home para hindi ma-infection yung kanyang ang kanyang sugat, or pwedeng turuan mo rin siya ng nutrition, ano yung mga healthy foods na dapat niyang kainin. Kasi halimbawa, hypertensive si client. Okay, outpatient department, kailan siya babalik for follow-up. Ito, kasama na yung diet dito sa health teaching mo. So, that's the methods. Okay? And the sign and symptoms. Ano ba ang mga sign and symptoms na dapat tandaan ni patient kung kailan siya kailangan magsisik ng consultation, lalo na pag mga emergency na ito, emergency situation. Okay, so let us proceed. So in developing your nursing care plans or NCPs, this is actually the end product of the planning phase of the nursing process. Okay? Meron tayong informal nursing care plan and the formal nursing care plan. When we say informal nursing plan or nursing care plan is a strategy for action that exists in the nurse's mind. Formal nursing care plan, it is a written or computerized guide that organize information about the client's care. So, meron ka talagang written. So, kapag informal, siguro sometimes yung mabilis ang gawa mo na lang. Sige, pababain ko yung temperature ni client. Sometimes informal na ginagawa. Lalo na kapag nasa bahay ka lang or nasa tawag dito, home base ka or yung mga private duty nurse, 'di ba? Private duty nurse, hindi na sila nagra-write. Halimbawa, mataas ang temperature ni client. So, wala na silang formal nursing care plan na ginagawa. So, in your formal nursing care plan, meron din tayong tinatawag the standardized care plan and the individualized care plan. So, for standardized care plans, the groups of clients with common needs. So, meron ng group. Individualized nursing care plan, it is made to meet the unique needs of a specific client. So, naka-individualize. Pag standardized, so pwedeng nakaganyan na yan. Basta kapag ganito ang patient, pataas ang ganito, ito na yung standard na ibibigay natin. So, meron tayong standardized care plan. So, standardized approach to care planning is are printed guides for the nursing care of the client who has a need that arises frequently in the agency. So, meron nang nakapost dyan or meron na talaga tayong standardized care plan kapag just in case na merong emergency in a specific department. Protocols are pre-printed to indicate the actions commonly required for a particular group of clients. Meron na rin protocol, could be published in each department. Na halimbawa, kapag nag-code ang client or may emergency, ito yung dapat nating gawin. Ito yung mga steps, ito yung mga una, ito yung mga priority. Okay. So, policies and procedures are developed to govern the handling of frequently occurring situations. So, frequently occurring situations, ito yung madalas na mangyayari doon sa department na yun. Kasi halimbawa, MS department, medical surgical department, or critical area department, or ICU, intensive care unit departments. ICU, ang madalas merong emergency, merong nag-a-arrest na client, kadalasan nangyayari yun. So, meron na silang policies and procedures of how to handle such kind of situation. So, standing order is a written document about policies, rules, regulations, or orders regarding client care. This gives the nurse the authority to carry out specific actions under certain circumstances if the physician is unavailable. Okay. Hindi, meron ding standing order. May example din ng standing order like medication. So, halimbawa, ito yung nangyari sa client. May history si client ng allergy. Binigyan si client ng antibiotic. So, binigyan siya ng certain medication. Kahit nagkaroon ng skin test, but possible, baka ito yung ma-feel ni client later. So, mayroong standing order ang doktor na ito yung ibibigay. So, may mga standing orders tayo. So, this is the format of your student's nursing care plan. Okay, it's in the form of a table. So, your assessment, your nursing diagnosis, your inference, so based on your nursing diagnosis, what is the goal or objective? Okay, goal based on your diagnosis, nursing diagnosis again, and what is your intervention, and the rationale, why you have to do that kind of intervention. May example na rin tayo in the previous presentations or slides, and then the evaluation. Okay. So, alam na natin that your rationale is the reason for selecting a particular nursing intervention. And this is considered as your concept map. No? It is a visual tool in which ideas or data are enclosed in circles or boxes of some shape and relationship between these are indicated by connecting lines or arrows. So, pwede ka rin magkaroon ng another part dito. May concept map ka. Okay? Sa nursing care plan, gagawa rin kasi ng concept map. Okay. Pero hindi ko na papagawa sa inyo yon. Ito lang, yung table lang muna. Later on na yung concept map. Maintindihan nyo rin yan. So, multidisciplinary care plan. So, it is a standardized plan that outlines the care required for clients with common or predicted or usually medical conditions. It is also referred as collaborative care plans or critical pathways. So, what are the guidelines for writing the NCP or nursing care plan? The date and sign the plan. Of course, use category headings. Use standardized or approved medical or English keywords rather than complete sentences to communicate unless the agency policy dictates otherwise. So, example, can be seen on your page 216. Okay? Be specific and refer to procedure books or other sources of information rather than including all the steps on the written plan. So, you have to tailor the plan to the unique characteristics of the client by ensuring that the client's choices such as preferences about the time of care and the method used are included. Ensure that the nursing plan incorporates preventive and health maintenance aspects as well as restorative ones. You have to ensure that the plan contains interventions for ongoing assessment of the client. Also include collaborative and coordination activities in the plan. Include plans for the client's discharge and home care. So, the planning process. So, ang haba, no? Planning pa lang tayo. So, you have to set priorities. Again, establishing client goals, there's an intervention, and writing care plan. So, in priority setting, it is the process of establishing a preferential sequence for addressing nursing diagnosis and intervention. You have to prioritize according to life-threatening problems. Is it life-threatening problems? It should be high priority. Health-threatening problems, that is your medium priority. Normal development needs or requires minimal nursing support, that is your low priority. So, in setting priorities also, you can again use the Maslow's hierarchy of needs, okay, the physiologic needs, diba, physiologic needs natin, pero actually sa ating CPR or cardiopulmonary, before it is ABC, airway first, breathing, kasi airway, actually dito yan, under your physiologic needs. But, nagkaroon ng mga recent studies na parang inuuna, diba, usually sa CPR, inuuna yung, diba, look, listen, tapos breathing muna to rescue breath bago mag-pump. But then, sa bagong CPR ngayon, inuuna ang circulation. So, give pump muna. 30 compressions, 30 chest compressions muna. Inuuna ang circulation bago yung to rescue breaths, yung sa breathing, bago yun. So, circulation, airway, and breathing. So, yun yung setting priorities natin. Pwede kang mag-base doon. Naintindihan nyo ba? Or naguluhan kayo? Okay, so medyo maguguluhan pa kayo kasi medyo konti pa ang concepts or terminologies that you know about nursing. Okay. Pero later on, maintindihan nyo rin itong CPR, prioritization. Okay? So, factors need to be considered in setting priorities are the following, no? The client's health values and beliefs, the client priorities, the resources available to the nurse and the client, the urgency of the health problem, and the medical treatment plan. So, di na natin isa-isa niya, haba na tayo. That is very self-explanatory. In planning setting goals, the goal should be a general statement of that indicates the desired change in the client's health status. And it should be SMART. Ano ba yung SMART? It should be specific, measurable, attainable, realistic, and time-bound. So, intindihin nyo yun. Ano ibig sabihin ng SMART? Expected outcome. Ano expected outcome mo dun sa goal mo? It is a detailed, specific statement that describes the methods through which the goal will be achieved. Diba? Ano yung goal mo? Pababain ang temperature ni client. Okay. Specific, measurable, attainable. Okay. Short-term goal. Meron tayong planning, meron tayong short-term goal, meron tayong long-term goal. Ilalagay nyo rin yan doon sa inyong NCP. So, the short-term goal is a statement written in an objective format demonstrating an expectation to be achieved in resolution to the nursing diagnosis in a short period of time, usually few minutes to hours or days. Ano yung mga yun? Actually, yung temperature natin, it can be short-term goal. Pwedeng short-term goal yan kasi in a few hours, pwedeng bumaba. Okay. Pero yung talagang totally mawawala ang kanyang fever, pwedeng maging yun, depende doon sa case ni client. The long-term goal is a statement written in an objective format demonstrating an expectation to be achieved in resolution of the nursing diagnosis over a longer period of time, usually weeks to months. Halimbawa, ano ba yung goal mo? Is the patient is meron siyang comatose, na comatose ang client. So, may problem ang kanyang left, hindi makagalaw si client. So, para maibalik mo yung movement ni client, so yung ROM natin, gagawin natin ROM, yung exercises ni client, yung blood circulation, para mag-improve, maka-perform siya ng activity of daily living, it takes times. It took weeks or months bago mabalik yun. So, that is part of your long-term goal. Yung mobility ni client na ma-achieve niya ulit. Yan. So, marami pa tayong example. You can search for an example of short-term goal and long-term goal. You can find it in your book and in Google. Okay? So, components of goals and expected outcomes. So, the subject. So, it identifies the person who will perform the desired behavior or meet the goal. So, behavior or verb describes what the patient will do to achieve the goal. You can use of measurable verbs. Criteria of performance. Okay, standardized, indicating the nature of actions, how long, how far, how much. Okay, conditions or modifiers. It is an optional component. Refer to the aid or condition which facilitates performance. Okay. Behavior. Ito yung mga example. Will verbalize, will ambulate, will report, will eat, will demonstrate. So, the client will eat, will demonstrate, will ambulate. Okay. Criteria of performance. Understanding of medication regimen, length of the hold, decreased pain level of 4 or less, 75% of meals served kung before ayaw niyang kumain, decrease BP within 48 hours. Yan yung criteria. These are just examples. Marami pa. Conditions, okay, will with assistance of physical therapy. The client will ambulate within, criteria natin, no? Within, the client will ambulate within 5 meters with the assistance of physical therapy or with the administration of analgesics, with assistance of family, with use of medication and diet therapy. That is an example of your conditions. Planning, nursing diagnosis natin is the goal, pain. Ano nga ulit to? This is the problem, the chronic pain related to inflammation of joints. This is your problem. So, ano to? Two-part. Diba? Two-part. Nursing diagnosis. The goal is, after 8 hours of nursing intervention, the client will be able to alleviate pain perception as manifested by, so short-term goal, kasi hours lang. Expected outcome. Ano yung expected outcome mo? Verbalized decrease of pain from 7 to 8, from 7 to 2 in a scale of 10. Or identify factors that influence the pain experience. Client and significant other administer pain medication appropriately. So, that is your expected outcome. Examples. So, alam nyo na, sa planning nyo ha. Implementing. So, we are now on the fourth phase of nursing process, the implementing or intervention. Okay? So, in implementing or intervention, it involves the following. Reassess the client, determine the nurse's need for assistance, implement the nursing interventions, supervise delegated care, and document nursing activities. Okay. Okay, implementation. It involves the execution of the nursing plan of care derived during the planning phase of the nursing process. So, meron ka ng plan. Ito na yung action mo. Implementation, gagawin mo na. So, it involves activities, ongoing assessment, establishing of priorities, allocation of resources, initiation of nursing interventions, documentation of intervention, and client responses. So, in implementation, you can also delegate, or delegation is the process of transferring a selected nursing task in a situation to an individual who is competent to perform the specific task. The task that cannot be delegated is example, assessment, evaluation, health teaching. Hindi mo pwedeng ipagawa yan sa iba. Assessment, ikaw dapat as a nurse kasi kailangan mo ng data. Ang evaluation, ikaw rin dapat para makita mo na ano talaga, ano ba pwede mong i-delegate. So, pwede mong sabihin kay nurse nursing aid na, okay, pakipunasan mo si patient kasi mataas ang kanyang fever. So, ayan yung implementation mo. But in evaluation, ikaw nag-assess nun, ikaw kumuha ng temperature. Evaluate mo, ikaw din yun. Ang magbigay ng health teaching, ikaw din. Hindi mo pwedeng i-delegate yun. Okay, tandaan nyo yan ha. Baka lumabas yan sa true or false. Okay, jokes. Okay? And then, let us now move on to so, hindi masyadong mahaba ang implementation kasi this is your action eh. Ito lang yung mga gagawin mo doon sa plan of care mo. Evaluating. Okay. Your evaluating includes the following, no? Collect the data related to the outcomes, compare data with the outcomes, relate nursing actions to client goals or outcomes, draw conclusions about the problem status, and continue or modify or terminate the client's care plan. Terminate kasi you are successful. Your plan, your goal was achieved. But if not, you have to continue and you have to modify it. Okay. So, evaluation, it involves determining whether the client goals have been met, partially met, or not met. So, yan ang ibig sabihin ng evaluation. Met mo ba? Partially met or not met? Okay. The purposes is to determine the following: client's progress or lack of progress, effectiveness of your nursing care plan, overall quality of care provided, and to promote nursing accountability. That is. So, therefore, your evaluation must be performed as a systematic process. Systematic din. Kung systematic yung assessment mo, systematic din yung iyong evaluation. So, it is organized. Occur on an ongoing process and lead to revision of the plan of care when needed. Involve the client, the significant others or relatives, and other member of the healthcare team, and it must be documented. Okay. So, what are the methods of evaluation? Of course, establishment of standards, collecting of data. Okay, may na-establish kang standards kasi doon ka magbe-base kung na-meet ba yung standards para ma-check mo if the evaluation or if the plan of care was successful. Collecting data, determining the goal achievement, relating nursing actions to client status, judging the value of nursing intervention. Ano ba yung nursing intervention mo? Maganda ba siya? Pwede ba natin isama sa pag-aaral yan para magkaroon ng evidence-based at mai-apply sa iba later on? Reassessing the client status, modify the plan of care kasi hindi naging successful. Critical thinking and evaluation. So, let us now proceed to documenting and reporting. Okay, documentation. Okay. These are the following terms under your documentation that you need to understand as well. So, discussion is an informal, oral consideration of a subject by two or more healthcare personnel to identify a problem or establish strategies to resolve a problem. So, it could be report. So, magkaroon muna tayo ng discussion, then report. Report is an oral, could be oral, written, or computerized-based communication that is intended to convey information to others so that this documentation or this data can be used, okay, for the treatment of client. Okay? Record is a written or computerized-based. Recording, Charting and documenting is the process of making an entry on a client record. And clinical record, chart, or client record is a formal legal document that provides evidence of the client's care. So we have guidelines for documentation or charting. Documentation or charting is the process of recording vital information about the client. So, ibig sabihin, importante po. No? Hindi lang basta-basta kung ano isulat mo dyan. It is part of the client's record and becomes part of a legal document. Later on, pinag-usapan na natin yung legal aspects of nursing in our previous discussion. So, guidelines for documentation or charting. The following rules for charting narrative notes will assist you to maintain an acceptable chart. Okay. Use ink, not felt pen or pencil. Black is best. But of course, depende pa rin, no? Depende pa rin kasi yung charting natin sa hospital may mga oras. So, may color, may color coding. Kapag gabi, kapag night shift, red, kapag day, 6 to 2, like blue, and, black, and then 2 to 11, blue, yan. So, may mga color coding tayo. Depende sa hospital institution. But in the Philippines, parang yun yung common sa atin na kapag night shift, red, day shift, black, afternoon shift is blue. Correct errors by drawing a single line through the error. Write the word error above. And then sign your signature. Okay, dapat walang error actually. The error must be readable. Ink eradication, erasures, or use of occlusive materials are not acceptable. So, dapat readable yun. Ano ba yung error na nasulat mo? Okay? Signs each entry with your first initial, last name, and status. Example, SN for student nurse or RN for registered nurse. Script, not printing, is used for the signature. Each signature should appear at the right-hand margin of the nurse's notes. Notes should appear on each succeeding line. Lines should not be omitted in the nurse's notes. A horizontal line is drawn to fill up a partial line. Continuous charting is done for each entry unless a time change occurs. You do not need a new line for each new idea or statement. So, entry should be concise, complete. Sentences are not required. Start each entry with a capital letter and end the entry with a period even if the entry is a single word or phrase. So, ito we're referring here to the charting. The date is entered in the date column on the first line of every page of nurse's notes and whenever the date changes. Time is entered in the time column whenever a new time entry occurs. Do not put time changes in the text of the nurse's notes. If only one time is entered for block charting, enter the last time you were with the patient. So, I hope you can imagine this, no? I will post an example of charting. Okay, example of charting. I will just post kasi hindi ko naihanda dito ang example. So, ilalagay ko na lang sa canvas. Chart objective facts, not your interpretations. For example, chart 100%. Not good appetite. Okay? If the patient offers complaints, place the complaint in quotation marks to indicate that it is his statement. For example, care of chest pain, radiating down left arm. Okay? Objective data is to be charted as well. In addition to the statement offered by the patient, the nurse should chart observation, like example, skin cold and clammy, diaphoretic, vital signs stable. So, yan, kasama din siya. Refusal of medication and treatments must be documented. A circle is placed around the time the medication or treatment is to be given in the appropriate area of the chart. An explanation as to the reason medication was not given is entered in the nurse's note. Sign each entry before it is replaced in the chart rack. So, an entry is not to be left unsigned. If all the charting is completed for the shift at one time, a single signature is placed at the end of the charting. So, accuracy is important. Describe the behaviors rather than the feelings. This allows other healthy member to determine the actual problems of the patient. So, behavior rather yung feelings mo or feelings ng client. Chart only those abbreviations and symbols approved by the facility. Information can be misinterpreted or misleading when unfamiliar abbreviations are used. Spell correctly using proper terminology and grammar. Write legibly. If writing is not legible, then print. Chart only what you personally have done or observed. An exception to this rule is what you are responsible for charting for non-professional personnel. Do not use the word patient or PT in the chart. The chart belongs to the patient. Okay? Do not double chart. If something appears on the flow sheet, it does not need to appear on the nurse's narrative records unless there is alteration from normal. Flow chart. Ma'am, ano po ba yung flow chart? So, actually, hindi nyo pa masyadong ma-appreciate to. Pero, kailangan balikan nyo to para at least medyo na-picture out nyo siya. Kasi wala pa kayo sa area. Meron kasi yung chart kasi na client, may maraming mga documents doon. May mga flow chart doon, flow sheet doon sa client, yung mga intake and output, merong mga vital sign sheet, yan, may mga ganun doon. Do not squeeze information into space because you forgot to chart it earlier. Add the information on the first available line. Write in the time the event occurred, not the time you entered the information. The following information should be charted: the physician's visit, the time patient leaves and returns to the unit, or mode of transportation and destination. Kailan yung leaves? Bakit nag-leaves? Ba't bumalik sa unit? Baka dinala siya sa laboratory. Anong oras umalis si patient para magpa-laboratory? Anong oras bumalik? Medications, chart immediately after given. Include the dosage, route of administration if parenteral were given. Okay, treatment. Chart immediately after given kung may treatments na binigay. So here is an example NCP. I asked this actually from a 4th year student. Okay. Here, this is an example of NCP. The patients, of course, you cannot, just don't write. This is just the initials of the client. They are 7 years old. The medical diagnosis is chronic immune idiopathic thrombocytopenic purpura with pneumonia. So, as you can see here, meron subjective, no? Paggising pa lang niya, pagkain na agad hinahanap as verbalized by the relatives of the patient. So, ito yung relatives. Ito yung sinabi niya upon interview. So, napansin ito, kakain, mahilig siyang kumain. Okay, mahilig kumain si client. So, kahit may sakit siya, mahilig siyang kumain. So, imbalanced nutrition, more than body requirements. Yun yung na-formulate nila na nursing diagnosis related to excessive intake in relation to metabolic needs and poor habits. Tapos, may inference, may goal, may short-term goal, may long-term goal, may independent function, okay, may collaborative function, and the rationale, and of course the evaluation. So this is just an example. So I want you to create an NCP. Meron akong scenario that will be posted on your nasaan na to? Paano na to ilalabas dito? Okay? That will be posted on your canvas. Okay? So yun lang pala siya. So, group work, please refer to uploaded assignment on your canvas. Okay, so actually, this is our presentation, and I will just post also the sample NCP. Titingin ako ng maganda pang NCP, or you can check NCP online. So, hindi nila ako magpo-post ng NCP kasi maraming NCP, sample NCP online para makita ninyo. Just look at the NCP that we have the same format with us, yung merong inference. Okay? So, kung ilang column yung ating NCP, so just look at that. And then, for your group work, it is posted on Canvas, where in each group you are asked or tasked to do dalawang NCP per group. Okay? May given situation, you have to identify ano ba ang problem doon sa situation na yon. Usually, yung situation na yon, makikita mo kung anong problem. You have to look at the chief complaint of the client. Pag walang complaint ng client, look at the data. Okay, the assessment data, the vital signs, and so on and so forth. From there, you can formulate a nursing diagnosis, and then you can create. Pwede nga kayong gumawa rin ng halimbawa, pwede kang gumawa ng subjective data based on the scenario. Kahit hindi ko nilagyan to ng subjective data, pwede nyo gawa. Halimbawa, may fever, mainit po yung pakiramdam ko, or any related to the situation that was posted also on the Canvas. Okay, so that will be your group work. Okay, so this ends our lecture on nursing process. I hope you learned something from that. And of course, you should learn. You should read your book as well. Kasi mas kumpleto yung nasa book, mas marami ang example yung nasa book, mas maiintindihan ninyo, mas more of explanation ang nasa book. So you really need to read your book. I will not provide a PowerPoint copy of this one because you have your book naman. Just read your book on nursing process. Okay? And then this ends our presentation. So let me read this to you. To do what nobody else will do, a way that nobody else can do, in spite of all we go through, that is to be a nurse. So the secret to surviving a nursing school is of course the following. Always think positive. Study your materials, your books, practice your skills. Take time for yourself. Visualize yourself as a nurse. Never give up on your dream. So thank you everyone for your time. I'm hoping and I'm praying that you'll be one of the best nurses in the future. So thank you. God bless you all. Of course, our reference, hindi ko pala naisulat dito, is the book of Kosher. Okay, Kosher and Herbs. Okay, so this is our reference. Kosher and Herbs, Fundamentals of Nursing. Fundamentals of Nursing, Concepts, Process, and Practice. Okay, 10th edition. So God bless you, everybody. God bless.